We have a crisis in healthcare in this country, and unfortunately government regulation and intervention is making it worse. We need healthcare reform in the United States, but unfortunately the way the government's gone about healthcare reform is making things worse. And the more healthcare reform we get, the worse things become. It comes out in several ways. First, we have an issue with a physician shortage. We are projected to face a shortage of 200,000 physicians in this country by the year 2020. And what's happening is that many of our best and brightest are no longer choosing medicine as a career, partly because they are discouraged by the messages they receive from currently practicing physicians. Many of the currently practicing physicians have lost the joy of medicine due to too much regulation and paperwork by the government and by insurance companies. The extent of paperwork a physician must do to satisfy both the government and insurance, and in order just to get paid for the care that they're providing, absorbs probably at least half of the typical 50 to 60 hour work week. Many physicians work more than that, but probably the average is 50 to 60. Half their time is spent doing paperwork that has nothing to do with actually caring for patients face to face. This does not make for a satisfying career. This is not why people went into medicine. When you ask physicians what they find most discouraging, high on the list is the amount of work they must do just to satisfy someone in a Medicare, Medicaid, or insurance billing office in order to get paid for what they do as a profession. And this paperwork is created by an over-regulated environment. In terms of regulation, I'm not against all regulation. I think some regulations are good when they are simple and they make a difference. Good examples are the speed limit. I think that makes a lot of sense. We need a speed limit. It's clear, it makes a difference. We need seatbelt laws. Okay? However, healthcare is so over-regulated and quite frankly poorly managed by the government that the money that could be spent on many things, including educating more physicians, is being spent on create an even more regulated healthcare system than we have currently. Two examples. I can give many, but two examples are, there's been a lot of talk about healthcare reform and creating what are called accountable care organizations, which are an organization that is to ideally increase quality and reduce cost. Unfortunately, these regulations have been created by what I would call a goulash of every idea that every ivory tower civil servant had to overmanage physicians and hospitals. It would appear that the groups of people developing these regulations have no experience in the real world of delivering medical care to a community or in running a medical group or a hospital. The proposed regulations are so unacceptable that the healthcare organizations like the Mayo Clinic, that the president touted as examples of how healthcare should be organized, have so far declined to participate in the new model that the feds have proposed because the federal proposals are so onerous and unacceptable. If the new regulations improve quality and control costs, then there might be some light at the end of the tunnel. Unfortunately, the impact on quality is too soon to know, but the impact on cost would appear to be all negative. In other words, costs are being driven up already. Healthcare reform has already started to drive up costs. It's happening throughout the country, and it's happening right here in Spokane, and that affects all of us financially. Second example is every time a physician provides a service, they have to provide two separate codes in order to get paid by insurance. They provide what's called a procedural code that says this is what I did, it's a 5-digit code. They also have to provide a diagnosis code. Well, just to give you a context, on the diagnosis codes, there are currently 10,000 different diagnosis codes that they have to choose from. If they don't choose the right one, they don't get paid by the insurance company, by Medicare. Well, that sounds kind of crazy, 10,000 codes, you have to get the right ones for the service. By the government's wisdom, those 10,000 codes are being expanded by the end of 2012 to about 60,000 codes. 60,000 codes that they have to choose from in order to figure out what they delivered for care in order to get paid. And if you don't put the right code down, you don't get paid. And the codes are so ridiculous that there are codes actually for 3 different episodes of being bitten by a killer whale. Okay? That's how ridiculous this has become. But, again, physicians have to learn how to play the game, or else they don't get paid for the care that they're delivering to populations, whether it's Medicare or people like you and me. Government regulation and policy drives up costs and creates an anti-competitive environment. Healthcare reform appears to be so heavy-handed that it's driving independent physicians to join much more expensive and better financed hospitals. Medicare policy and regulations pay hospitals 2 to 3 times as much for the same service that you used to be able to get in your independent physician's office. So when your doctor becomes an employee of a hospital and orders an x-ray for you, a CT scan, an MRI, a lab test, if you have an outpatient surgery, that will now cost 2 to 3 times more because that physician is employed by a hospital as opposed to them being independent. And the reason the physicians have become hospital employees is because hospitals get paid better. That's where the money is. Okay? It's basic business. So, and it's Medicare policy that is allowing this. Medicare policy, and they're not the only ones, other insurances do it as well, pays hospitals 2 to 3 times as much for the same service that the independent physician used to be able to do in their own office. The end result is that the more cost-effective provider, the independent physician, goes out of business because Medicare's payment practices contributed to driving them into the more expensive hospital setting. And there was actually a report by the OIG, Office of Inspector General, back in 2003 that talks about this. But again, this information has not been acted upon by the government. Finally, there is no transparency regarding the impact of government regulations in healthcare. The public, you folks, have no idea that the end result of physicians selling out to hospitals is that healthcare costs are going up. That information is hidden from the public. Medicare doesn't tell you. Your own insurance companies don't tell you. They don't tell you that what used to cost you $100 for a lab test, maybe from your own independent physician, now may cost you $300. They don't tell you that the facility fee for your outpatient surgery that used to cost you maybe $1,000, now it's going to cost you $3,000 with exactly the same service. The only difference is that it used to be provided in an independent physician office, now it's going to be provided in a hospital. And it's our tax dollars that are paying for this higher cost. We're all paying into Medicare, but it's also happening with your private insurance. So, I could go on. There are many other disparities. One of the things that's, I guess the final point I'll bring up is that Washington State is a very cost-effective state when it comes to delivering health care. You look at national data, Washington State has high quality and low cost. We get absolutely no recognition for that cost-effectiveness. High-cost states like Florida, New York, have always been high cost. Their quality is no better, actually is lower than what you get in Washington State, and yet Medicare continues to pay them much more for the same service than physicians and hospitals in Washington receive. Why? Because that's how they've always done it. They reward the high-cost, less efficient states and penalize the low-cost, more efficient states. Again, I could go on.
That's great.
But
thank you.
That's my
Great overview. Thanks.